If you're wondering what newborn reflexes are and what they mean, we're going to discuss all of those newborn reflexes with baby Zoe in this video. I'm Roxanne, I'm a labor and delivery nurse and student midwife, and we're going to be breaking down what the newborn reflexes are that we're assessing for and what they mean. The first reflex that we're going to check for is the rooting reflex. And this is when we're going to touch the side of their mouth or sometimes even just their cheek, and they're going to turn towards that. And this is when you have your nipple and you touch the side of their mouth. This is them rooting to that nipple to help with breastfeeding. The second one that's on the face is the suck reflex. So this is if we put our finger in their mouth and touch the top of their mouth, they're going to start to suck. And this is again to stimulate when a nipple touches their mouth. They're going to start sucking to help with breastfeeding. So these are two big reflexes to help aid in breastfeeding. The next reflex is the Plantar Grasp reflex. This is where we're placing pressure into the hand and then they're going to grasp on. And this grasp is strong, where like if I lifted her up, she would hold on to it. But we're not going to do that because her head is obviously not strong enough. The next reflex is the Startle reflex. And this is where like any loud like sounds or even like quick drops will cause them to bring their hands out to the side. Yeah. Ooh. Some people will even just like drop them onto a thing like that. And that is a big startle reflex, but obviously supporting their head. And this is one of the reflexes why swaddling, some people will recommend swaddling because it keeps them from startling themselves awake in the middle of the night. The last one that I'll check is on their feet. So this is both a palmar grasp, but this is the plantar grasp. So this is pressing at the tops of their toes and it grabs around your toe like the claw. And then I drag it down for the Babinski reflex and we want their toes to splay out. So all of these newborn reflexes are things that are seen in infants and young babies, but we should not be seeing it in someone who is an adult. Most of these reflexes will be gone between 6 months to 2 years of life, depending on the reflex. But we want to see them in babies because we call them our primitive reflexes. So these are the beginnings of our central nervous system continuing to develop. Some of them are useful where they're helping with breastfeeding. So they're helping us be able to get baby latched on and feeding. And these reflexes are helpful because they're going to help them also hit their different sensory and motor milestones. And if you want to learn more of what to expect with baby in the first month of life, check out our newborn and postpartum preparation course where we discuss what to expect with baby for the first month, but also for you, how to prepare for the postpartum to make it less stressful.